Resuming debate, the honourable member for St. Paul's.
Thank you, Mr. Speaker, and merci à mon collègue de député.
And I would like to thank my colleague, the member for Laurier-Sainte-Marie, for requesting this emergency debate.
I've been listening this evening, Mr. Speaker, and I think that all of us do not want this to be a political issue, but all of us, as members of Parliament, are asking the same question. Is Canada doing enough, or should Canada be doing more? And that's what Canadians are asking us, and particularly those who come from the country so desperate at this moment, pleading. This infection is not contained. That without containment, everybody in the region is at risk, and as we're learning today, that even the United States of America is preparing for the possible eventuality that disease could come to us. We learned a lot in 2003 from SARS because we weren't prepared, and because we really didn't have the structures in this country to speak to one another. And in the Dr. Naylor's report of lessons learned from SARS, we knew that we had to do better on collaboration, cooperation, communication, and a clarity of who does what when. The Public Health Network has now been set up, as has the Public Health Agency of Canada. The Public Health Network, I think, is doing an excellent job across the country with their weekly calls and letting one another know what they're doing and what's at risk and what they believe can happen internationally. The Public Health Agency, unfortunately, is still without a permanent Chief Public Health Officer of Canada. It means at times like this there is not the trusted voice speaking directly to Canadians, and I think Dr. Greg Taylor, as the acting Chief Public Health Officer, has done his best. But when the lessons were learned from SARS, it was extremely explicit that there needed to be a trusted voice of public health speaking to Canadians at times like this. And frankly, Mr. Speaker, it's been over a month since Canadians have had any conversation about this from a public health official of Canada. And at that time, it was really merely an announcement of the expert and exciting news about the possible vaccine. But again, when it's delivered by the Minister of Culture and Heritage in her hometown, this actually, unfortunately, smacks of politics instead of a clear message to Canadians about what they need to know and what they should be telling their families and friends about this exponentially increasing disease around the world. It's only 10 days now since I think the very excellent CBC post by Amber Hildebrand in CBC News talked about the dire predictions of 20,000 people, more than 6 times the current toll. Where in the article it talked about Médecins Sans Frontières saying its 1,800 staff are overwhelmed, and that it is turning to governments capable of deploying military units and running self-contained field hospitals. That's what MSF is asking for, and that's what we haven't heard tonight. We haven't heard once tonight from the government side that they will assess and do more if necessary. Canadians want to know that Canada will step up, and I think that they have not heard that message. The parliamentary secretary said that the critics had a briefing. I have to say that the briefing deck that I just looked at is the pretty thin gruel when you look at the international assistance and collaboration. 3 bullet points that starts with the $5 million that we've heard about countless times tonight, the NML, or the National Microbiology's mobile lab, that was sent, but then, of course, the 3 staff were brought back because there was an infection in the hotel which is again a mixed message that we're hearing from Canadians. They haven't had an explanation. If it's only can be contracted by bodily contact, but by bodily fluids, human to human. People didn't know why those staff came home. And those are the questions that Canadians are asking parliamentarians, and it's the reason parliamentarians need proper briefings in order to be able to contain the fear. We don't want to fear monitor, but we do want to have specific answers. And also the donation of the doses of experimental vaccine. So 3 bullet points in a deck, and then unfortunately in the deck the closing remarks say merely Public Health Agency will continue to monitor the situation in West Africa and keep Canadians informed as the situation evolves. What Canadians want to know is, are we doing enough and should we be doing more? And that was supposed to be the point of the debate tonight. And I'm afraid that this is so upsetting that we end up with this political defensive response instead of learning, and that we actually want to hear from medical professionals. And that's why it is extraordinary that in Canada we have this approach, which unfortunately has become, again, inadequate information from people not medically trained or not able to instill confidence in Canadians. That it's, that from the articles in the Lancet to all of the things that should have, could have, would have happened in terms of what should have happened as proposed by the WHO in 2011, what is now being called an international response fractured and delayed. That everybody now is scrambling as this thing is getting worse and worse and worse. And as Dr. Cornish from MSF Canada is called, the international response has been lethally inadequate. It is the past Deputy Chief Public Health Officer to Canada, Dr. Paul Gully, who in that same article talked about how it should work with other member states to a unified and coordinated response, hopefully led by the WHO. But he is concerned that the deployment needs consular response, the ability to evacuate workers if needed, money to pay health workers and insure them, plus training, food, lodging, travel. It's a lot of coordination that would be required, and Canada has probably some capacity that it could share, but he agrees it's not that simple. He's saying it's a responsibility that is ours, that is ours to. And well, actually, it was Dr. Cornish who said it is that the world has to step up to this emergency, and if the call is unanswered, this could clearly turn into a disaster and an outbreak of cataclysmic proportions. So even as we've experienced the debate tonight, things are changing today. Already in the UK, they're reporting the CDC decision to issue this 6-page action plan on how to tackle Ebola for U.S. hospitals. Now is the time to prepare. It seems that again they warned a week ago that the disease was out of control as a CDC worker contracted the illness, and that there is world leaders are pledging to invest in millions, and particularly I think with the President of Liberia's urgent plea to the President of the United States. So it is an urgent issue and call to action today from the CDC, because it's saying that this is the first time we've heard that experts saying that it's only a matter of time before the illness widespread across America. This is really different, and I think that it is hugely important to us here in Canada to understand, if we don't step up and go and help contain this infection in that continent, that we we are going to be very, very sorry, and I think Canadians are saying to me over the last little while, we could and should be doing more. It is, of course, today we learn that the U.S. Security Council is going to hold its emergency debate on Ebola on Thursday, and it will get attention, as we talked earlier in one of my questions, in Washington, as members of Congress are slated to hear from their federal officials that are leading the nation's efforts, and of course that President Obama is scheduled to visit the Centers for Disease Control and Prevention headquarters in Atlanta, and he himself will be briefed. Tomorrow it's expected that President Obama will detail his plans to boost the nation's efforts to help West Africa battle the Ebola outbreak, and the Wall Street Journal is just recently reporting today that the plan could include sending more portable hospitals, medical staff and supplies, as well as training health workers in the outbreak countries. As you know, Congress is currently considering Obama's $88 million request for the Ebola response, which is included in the resolutions to fund government for 3 more months past the end of their fiscal year, and that the U.S. House of Representatives have already introduced a bill that includes the amount of the administration. Also, tomorrow, federal health officials will testify before a joint Senate committee hearing on Ebola and the response change, and health officials on the witness list include the CDC and the National Institute of Allergy and Infectious Disease and the Director of Biomedical Advanced Research Authority. It is urgent, I think, that Canadians hear from the Public Health Agency of Canada directly, and that journalists and others are able to ask the really important questions, which is the core of this debate, which is, could and should Canada be doing more? That's what tonight's debate's about, is are we doing enough? And I think that across all party lines, everybody, in order to sleep soundly in our beds at night, needs to know that we've asked that question and that we've had good answers to those questions. Otherwise, we aren't doing our job as parliamentarians, in that we actually want Canadians to hear from the medical authorities as to what is possible, from our international development authorities, what's possible, from foreign affairs in terms of consular support, what are we stepping up, and are we in terms of those same places that the protective equipment announcement came from tonight, also has the hospital units and the portable hospital units. Should and could we be at least considering that? And how do I answer that question when I'm asked, should we be sending portable hospitals? Should we be sending some of our beds? Should we be sending some of the things that we have in depots all over this country where exactly the protective equipment came from? Should we be digging deeper into what's possible? So it is just a hugely important issue, and during SARS we were really reeling because we didn't have the structures in place of the Public Health Agency of Canada, of a chief public health officer, of a public health network. We are asking the government to let those people do their work and let them speak directly to Canadians and brief parliamentarians, and that a call to brief the critic of the two opposition parties is not speaking to our party. Are they supposed to then brief their caucus on this? Surely not. They have to come to committee, tell us what's going on, and then tell us what could be possible. Then it's up to Parliament to decide that we should do more if we were given the menu of choices and have it costed out, and then we would do the risk assessment and be able to make good decisions as a Parliament, in the same way as tomorrow night we will debate the contribution in terms of Iraq. This is as Dr. Keith Martin said, this should be dealt with as a natural disaster. and that we have to have that mentality of a disaster response as opposed to being able to just say the $5 million is enough and here's a little bit more equipment. This is not what I'm hearing, and I have to say, as I asked earlier in the day, we lived in Toronto the ill effects of a travel advisory for a disease that actually evidence-based could not be contracted in the community. I am hearing from many people that the travel advisory to those very, very vulnerable countries is perhaps dangerous there, and that again, if people can only get the disease human-to-human contact and by bodily fluids, it is again difficult for people to understand why this travel advisory was advised when many other countries have not done that, and what I am hearing is that it may well impede some of the information or some of the assistance getting into these countries because of a travel advisory. One of the other things we're hearing is that there are many doctors and nurses and health professionals across Canada who are thinking about joining the amazing Elise Cleary, the medical officer of health from New Brunswick, who's felt called to go and help. Obviously, Dr. Teresa Tam from the Public Health Agency. But there are other people with skills who want to know if they can help. It is too difficult for them to find out how to do that in the current configuration of websites and in Canadam or in the ways that this is structured, because most of our processes are not done for emergencies like this and not for this specific kind of medical assistance. So, we hope that the government will listen to what the President of the United States decides to do tomorrow, including appointing an Ebola czar that will actually be the person that Americans can listen to as to what is going on. It's extraordinarily important that Canadians have confidence, and that as they see what the CDC has rolled out in terms of all the American hospitals and the handbooks and the buddy system to make sure people wash their hands, make sure that all of the basic public health rules that sometimes aren't observed, that this is a teachable moment for even the upcoming winter flu if we could do a better job now in preparing for this. So it is clear and that Mr. Obama's announcement tomorrow is to underscore, in quotation marks, just how extraordinarily serious the administration has been in confronting what they call a top national security priority. And what the senior administration official has said is what is needed is on a scale that is unprecedented. I think that Canadians think that $5 million and some special equipment is not an unprecedented contribution. This is business as usual in terms of $5 million here and $5 million there and $5 million there for a whole myriad of problems that the country and the world is facing. We need a risk assessment as to what is the appropriate contribution to Canada to contain this epidemic and prepare Canadians for any eventuality in this country so that they feel confident. But that can only come if we stand up the Public Health Agency of Canada and the public health leadership in this country and let them speak directly to Canadians, let them speak directly to parliamentarians, and stop this game of politics and defensiveness of, everything we're doing is perfect, when too many Canadians have too many questions, too many parliamentarians have too many questions, and frankly tonight's debate was very helpful in terms of getting some of this out, but frankly the answers to the questions are not being given by people who actually have the medical knowledge to be able to give reassurance to Canadians or even to parliamentarians. Thank you, Mr. Speaker.
Questions and comments? Questions et commentaires? L'honorable député de Chicoutimi-Le-Feu.
The Honourable Member for Chicoutimi-Le-Feu. Thank you very much, Mr. Speaker, and I'd like to thank my Liberal colleague for her speech, which was really a plea from the heart. This was an interesting evening. It was a crucial topic, and I also share her opinion that the next step now should be to have Canadian experts to come and tell parliamentarians what the situation is really about. So beyond saying that, well, Canada should do this, invest more money for that, I would also like to hear responses from our experts. And the Health Committee is going to sit this week or next, and I am persuaded that my Liberal colleagues and my other colleagues who are just as passionate as we all are on this side, in order to sit in the House of Commons until midnight, you have to be passionate about the topic of your debate. And so I think we'd like to hear the opinions of experts. We're at a crucial stage in this crisis, so we need to move forward. So I'd like to confirm with my colleague whether she believes that on the Health Committee we should hear testimony from experts as soon as possible, perhaps next week when the committee starts to sit. There are many topics that are discussed on the committee. We do a lot of good studies, but I think that we really need to give priority to this issue so that the parliamentarians and Canadians can be better informed by real experts who have been working on this file for many years.
Honourable Member for St. Paul's.
Mr. Speaker, I fully agree that that is an excellent idea to invite experts from Health Canada, from the Public Health Agency, and perhaps international experts as well, for a real study to be conducted by parliamentarians on the Health Committee. But I think it is also necessary to have a briefing for all parliamentarians immediately.
Some comments. Questions and commentaires? The Honourable Member for Etobicoke North.
Thank you, Mr. Speaker, and I'd like to thank my colleague for truly an excellent speech that outlined the issues. It couldn't have been better. She did mention another urgent need is it's opening up air routes that have been closed to affected countries. These closures have a huge impact in impeding the flow of experts and supplies into Africa, and the outbreak itself is having a negative impact on the economies of Guinea, Liberia, and Sierra Leone. People need medical supplies, food, fuel, charcoal, and other provisions. The World Health Organization does not recommend any travel or trade restrictions be applied, except in cases where individuals have been confirmed or suspected of being infected with Ebola virus disease, or where individuals have had contact with cases of Ebola. And I'm wondering if she can talk about travel bans, as well as how the government might provide leadership. We have medical professionals who might want to contribute. Is there something we could be doing, the government could be doing, to make this easier for them?
The Honourable Member for St. Paul's.
Thank you. Some of the public health experts have suggested that in lieu of the travel ban, which was not recommended, that it again that whether it's CBSA or whether it's the airlines, that there could be a better approach to actually just information being given at airports as to where you've been. And then to list the symptoms that you should look for. We know that people in this particular disease, it's very good that they're not infectious unless they have symptoms. And so it's again very important that people who've been to these areas know what symptoms to look for, know how to get help, but that it is, I think that again, a bit controversial that these travel bans were laid on. And, you know, I just think that, again, we need to hear from the experts to find out if they think these are appropriate or whether or not they have complicated efforts in the region. So I also think that it's important for the Public Health Agency and the International Development to have a look at the website and try and make it easier to an easier on-ramp to the Canadians that might want to go and help in the region. As my colleague from Mississauga said, that this won't ever just be about money. Right at the moment, people need personnel, they need equipment, they need, but the actual experts and people that can actually go and know how to work safely, know how to teach and train other personnel, that's going to be hugely important. And in, I think, the U.S., there's been a very specific call for that, very, very eloquent and very easy, and I think we haven't seen that in Canada, of just asking for people to, like we did in Kandahar, like we did where so many amazing medical people just were able to go and work in the hospital there, work as x-rays, work doing all kinds of things. So I think Canadians would be generous with their time if they knew exactly how to do it, and I think that the government needs to have a full multifaceted effect. And I also think that it may be that, again, because this crosses many government departments, international development and therefore foreign affairs, health, that they're we've talked about and heard about a whole of government approach to this, but I think that we actually need to affect it, and that's the reason that just studying this at the Health Committee won't be enough.
Some comments. The Honourable Member for Chicoutimi-Fjord.
Merci beaucoup, Monsieur le Président.
Thank you very much, Mr. Speaker. The next question I have for my Liberal colleague. First, I want to be sure that the people who are listening to the debate at this late hour can realize what the scope of the crisis is, because according to the World Health Organization, some 4,200 cases have been confirmed in Guinea, Liberia, Sierra Leone, Nigeria, and Senegal. And WHO projects that 20,000 more people will become infected over the next 3 to 6 months. So the question I have for my Liberal colleague is, does she believe that the situation will be as bad as the WHO predicts if the Canadian government does not increase its financial and technical assistance?
Member for St. Paul's.
Merci pour votre question.
Thank you for your question. Yes. The projections are that 20,000 people will become infected. And it is very important that Canadian efforts be as intense as possible. It is always necessary to have an analysis of the situation done by experts, and after that, it is also very important for parliamentarians to determine the scope of our contribution.